working at a sports club in the evenings, on the weekends. I was on a stepping stone towards my journey as a sports physiotherapist. I just realized that my heart wasn't in it. And I realized connecting with and helping older people at a more vulnerable time of their life was something I just love to do.
In your experience, how do you make culture?
I think there's a few things. Firstly, you can describe culture in many ways.
During the bad stuff, the burnout, the funding cuts, a pandemic, where does that culture show up?
It really does help if you've got a culture system in place before a crisis arises, and that's not always the case.
In a healthcare organization, do you find that leaders ignore culture?
Most of us have been taught how to be technicians. Most of us have been taught how to be a healthcare professional. We have not been taught.
Welcome back to Healthcare Journeys, where we bring you stories from across the healthcare landscape, chronicling personal and professional journeys that shape the industry. My name is Kevin Rosenquist. Thanks for being here.
This podcast is brought to you by S2M Health, a trusted partner for U.S. healthcare payers and providers. From accurate risk adjustment coding to full spectrum RCM services, S2M Health combines clinical expertise with precision operations to drive better outcomes across the healthcare ecosystem.
What if building a great healthcare company wasn't about strategy first, but about culture? My guest today, Tristan White, founded the Physio Co. with a mission to keep seniors moving and living well. And along the way, he's been named one of Australia's best places to work 11 years running and wrote the book, Culture is Everything, a playbook for intentional leadership in people-centric industries like healthcare. Tristan, welcome. It's great to have you here.
Hello, Kevin. Nice to meet you. Nice to be here. Thanks for the invitation.
Absolutely. I'm excited to chat with you. This is an interesting topic, the idea of culture. But before we get into that, I'm curious because if my research was correct, you began as a physio aiming to work with athletes, with elite athletes.
Yeah.
What did you see in aged care that made you kind of completely shift your career?
Yeah, that was an early part of my career, Kevin, and I entered healthcare as a youth athlete. I played a lot of sport as a kid. My visibility of the industry of what a physiotherapist did was very limited. I thought sports physiotherapy was pretty much it. And so I went into the industry thinking that that's where I'd head. I did my undergrad degree. I graduated. I had my 5-year vision of my career that I was headed towards sports physiotherapy. And in the first year that I was working as a physical therapist or a physiotherapist in a clinic, treating typical shoulders, necks, and backs, and working at a sports club in the evenings, on the weekends, I was on a stepping stone towards my journey as a sports physiotherapist. I just realized that my heart wasn't in it. I didn't love the work as much as I thought I was going to love. I didn't think it was as meaningful as I thought it could be. And I thought there was a better way to use my skills. And so I reflected on what I'd enjoyed during my university, what was important to me in life. And I realized connecting with and helping older people at a more vulnerable time of their life was something I just love to do. And so I made an early pivot, and that was more than 20 years ago now. And I've been working with older people ever since.
Well, that's really cool. That's interesting too. It's always, you picked a certain area that you obviously like, but it's always interesting to me when what you always thought you wanted to do with it, and you get in it, and then you're like, I don't think this is really what I want to do. And I find that fascinating.
Yeah, well, I think we can talk some more about that, Kevin, but I think that there's a real skill and quality and value of self-reflection and not being reactive to the bad days or the bad weeks, but being deeply aware as to what is meaningful and helpful for you as an individual as you work through your career.
Mm-hmm. You've grown quite a bit in the last 20 years, or how long has your company's been around for 20 years?
Yeah, we celebrated our 21st birthday this year, Kevin. So yes, so we're in our 22nd year.
And you've got, did I see this right, you've got like over 150 team members, is that correct?
Well, we have. This is an interesting story, Kevin. I'll quickly fill you in. Right now, we do not have 150 team members. We grew from just me, focused in aged care, and I grew the team. It was just me, then a smaller team. We grew into multiple states of Australia, and we got to a maximum team size of approximately 150, serving older people in aged care facilities in 6 states of Australia. And that was a wonderful business, and we're doing some useful work. But again, upon self-reflection, we didn't think we were doing the work that we could be doing as well as possible. The older people in nursing homes were the people we wanted to help. Ultimately, though, we were helping the nursing home institutions by doing assessments and care plans and documentation, and we weren't getting enough time and energy and hands-on, if you will, with our clients. And so we made a significant pivot, a significant change, which resulted in a change to the size of our business, and that is that we are now focused on helping older people in their own homes. We visit people in private homes and retirement villages now in 3 states of Australia with a smaller team, less than 50 people at the moment. Kevin, we've pivoted, we've resized, we've reshaped, and we're headed towards another growth phase, but a slightly different customer based upon a refocus on our purpose and how we can be the most useful as we possibly can in the world.
Interesting. Yeah. I mean, I feel like a lot of healthcare startups grow pretty fast, but yeah, kind of lose a personal touch, right? I mean, it's kind of like, it sounds like you kind of decided to kind of preserve the heart of your work.
Entirely it is. And we, it was a huge challenging decision for us to make that move. And because there's the hearts and minds and connections of 2 groups of people were significantly affected. One was the older people in the nursing homes who we opted to make a shift away from, and we had great connections with them, and we really thought that we could be of great value to them. However, we could be more value to others. And similarly, the people in our team, there were people in our team who continued to work in those institutions in aged care, but not for the Physio Co, because we opted to move somewhere else. And so, yeah, it was a challenging time, but it's definitely the core purpose of the Physio Co, which is a critical part of our culture. We exist to help seniors stay mobile, safe, and happy. That's a driving force for us. And if we're not helping seniors to stay mobile, safe, and happy because the industry changes or something adjusts, then we will use that as our flag in the ground, if you will, or filter to move towards the right direction for us.
Okay. Now, I'd like to shift to the discussion of culture. I think it's very interesting. It's definitely a word that's thrown around a lot. I'm also a big sports fan, and you hear coaches and players and media personalities. They love to use that word culture, change the culture. The coach brought in a new culture, all that stuff. In your experience, how do you make culture something that's real and measurable and not just the buzzy term that gets thrown around in examples that I just gave?
Well, Kevin, I think there's a few things. Firstly, you can describe culture in many ways. I reckon culture equals character. Culture equals the character of a group and a character of the individuals in that group. And what we do, sports is a great starting place, because we hear about all sorts of culture-related stories. Miami Heat, as an example, have got this wonderful heat culture they speak of, and there's many parts to that. But I think we hear about the power of culture in the good times, and I'm not with you to invest in culture for good times. I'm with you to invest in culture for the tough times, because I think that culture is a foundation that can be a strong set of beliefs and guiding principles and a system that helps you navigate those tough times. But the tough times are not always the ones that's written about when sports teams win championships, or when organizations make it to the fastest lists and the startup lists and all that sort of stuff. But to me, Kevin, to circle back, culture is the character of a group. It's really important to invest in it for the tough times. And there's really 2 options that we've got with culture. One is you can have a culture by default where no one's paying attention to culture, or we can have a culture by design where we actually put a system in place and we lead our culture so that then the culture can be a driving force behind the growth of our team. That's my thoughts on culture, Kevin.
Okay, that's interesting. Yeah, because I mean, you're right about the bad times, and also I feel like there's no better time to use it as a buzzword than during the bad times. And I guess again, I'm using that sports analogy. It's almost like a way to talk about, hey, we need to make changes at the company, at the team, whatever. And this is the word I'm going to use for it because it's just convenient at the time. But during the bad stuff, the burnout, the funding cuts, a pandemic, where does that culture show up where someone like you comes in and goes, we need to fix this?
Well, Kevin, it really does help if you've got a culture system in place before a crisis arises. And that's not always the case. And many businesses then start using buzzwords because they don't have the foundations or systems in place. But in my experience, and I learnt this during the COVID pandemic. I live in just outside of Melbourne in Victoria, Australia. The state of Victoria was locked down for one of the longest periods in any part of the world. We had real challenges running our businesses during COVID. And one of the real important things that I learned during that period, I had a lot of work to do to communicate and guide our organisation with a great set of leaders at the Physio Co. But one of the things that I learned is it's the job of the leader to absorb fear and to exude hope. To absorb fear and exude hope during tough times. And I think if you've got a culture system in place with a core purpose, a set of core values, a vision as to where you're headed, and a set of communication rhythms as to how we communicate in a business, then I think those systems, you can absorb absorb fear and exude hope you do that by sticking to your system, communicating where you're headed, communicating what's gone wrong, what we're doing now, and where we're headed. And I think culture is ultimately your character of the culture is defined by what you do in the tough times, and it doesn't come from making it up on the run.
Mm-hmm. Is this something that you feel should be documented? Do you help encourage companies to, like you said, have a culture in place? Mm-hmm. Is it an actionable thing? Is it, okay, here's what our company culture is going to be, or is it more of a mindset?
Yeah, good question. So the answer is, for the leaders, it needs to be a mindset. Firstly, a mindset. A mindset is that we were going to have a culture by design. We're going to lead our culture and not be led by the reactiveness. And secondly, you can absolutely put a culture system in place, and that is in the intro you mentioned the book Culture is Everything, and Culture is Everything is the documentation of the story of the Physio Co's early growth, but it also documents the culture system that we put in place. And that is not necessarily something that I invented or created, but it's an accumulation of many tools and many ideas that others, brighter people, smarter people than me, Kevin, that have come up with ideas, but the system, putting them together and how to use them and how to stick to them when things get hard is what the culture system is all about.
And you have a 19-step system for culture. In your experience, we're a healthcare podcast, so in a healthcare organization, do you find that leaders ignore culture, kind of hope it works itself out, don't think it's important, those kind of things?
Well, let's zoom out for a moment, Kevin, and the 19-step checklist that you mentioned, which has got 4 parts. There's 4 parts. It's discover the core, document the future, execute relentlessly, and show more love are the 4 parts of the system that I believe are really important. And healthcare leaders, like everyone in healthcare, have got this amazing empathetic brain and empathetic personality, and they've got a huge heart. But most of us have been taught how to be technicians. Most of us have been taught how to be a healthcare professional. We have not been taught and educated and understand how to be a culture-first leader. And that's a huge challenge, because on the run, me included, we default to our technical skills, the reactive technical skills, as opposed to the zoomed out, calm, culture-first leadership skills, which are useful in those situations. And so the answer is that, like learning the skills of being a healthcare professional, you can learn the skills of how to be a calm, passionate, patient, and clear communicator in these tough times. But we've got to do it with intent, as opposed to believing it will happen and we can figure it out when we get to a challenging moment.
If a healthcare team is struggling, where do leaders usually find that foundation is kind of cracked first?
So leaders do not hear firsthand information from their team before it can be almost too late, in many experiences. And so that's why it's so very important to have an intelligent system, and that's a fancy word for saying you talk to people at the front line, you talk to people in your business, you gather feedback. And so I talked about communication rhythm before, Kevin. Communication rhythm is how you connect with your team and how your team connects with each other. And I firmly believe, and this is something I've learned along the way, there needs to be a daily, weekly, monthly, annual, and quarterly and annual rhythm. And what that means is teams connect in a huddle every day. Just a quick huddle before the shift or during a shift to find a spot to make sure that people are connected and that if there's any challenges or problems, call it a handover, if you will. Then that's a daily meeting. A weekly meeting is where a team connects for a little bit longer. Often there's some learning and some PD associated with that learning. Monthly is a bit more of a deep dive. What's coming up? What's worked? What hasn't worked? What's coming up? Maybe a bit more PD. Quarterly should be more company-wide or association-wide, whatever it might be, but to hear from leadership and connect with leadership. And annually, we're just coming off our annual team conference at the Physio Co 2 weeks ago, and we connect offline, tools down, and we learn about how we can be better people, better professionals, better communicators, and make sure we learn, we grow, and celebrate at a conference. And I tell you all that sort of stuff because if you put a rhythm like that in place, and then the leaders take the time to attend those meetings, to ask questions, to gather feedback, and have a feedback loop in place, then we can usually, not always, but usually we can read the trends. We need to be students of trends, and make sure that we see and respond to things, not the one-off complaints, but more the learnings and the trends that happen from those things. And so that's the best approach. It's not perfect. It's, of course, we have to be reactive, responsive when the time happens, but I think you can be more prepared for not having crises after crises.
Yeah, that's interesting because it's more than just it's more than just sending out an employee survey, and it's more than just about checking in with your management and things like that. So you're saying it really needs to be like an overall mindset of communication, feeling connected, feeling that everybody is connected and that they're all on the same page, and doing that regularly rather than the standard monthly meeting that everybody dreads.
Entirely.
Yeah.
And I think, Kevin, that leaders need to be interested, critical. If you are interested in your managers, and your managers are interested in your supervisors, and your supervisors are interested in your team members and health professionals. And if you showed up in our business, and this happened to me yesterday, I was on a Zoom call with a team member, and we had a daily huddle. 4 of us on a daily huddle, 10:04 in the morning, goes for about 9 minutes. We connect, we work through what's happening, and at the end, we say thanks, have a great day. And I asked 2 of the people can you stay on the call. Got a couple of things I want to work through with you. No problems. The other person left. One of my leaders looked me in the eye via the camera and said, "Tristan, you all right?" And I obviously wasn't communicating in as calm, clear, connected way as I often were. She could tell that there was something not quite right with me, and she was very clear with her communication in a caring way to say, "What's up? I can see things aren't quite right for you. Anything I can help you with?" And that's a sort of interested approach of a strong character that we see at leadership. We need to see that all the way through our business. And when you respond like that, that's when you can get the information that can tell you that there is an upcoming crisis or challenge or concern happening in your business. You just didn't know about it if you weren't interested in following up those little clues or those little leads that you can get.
That's interesting because so often most of us have worked for companies that maybe leadership is aloof at best, not really engaged, not really involved in the day-to-day activities, don't really know their employees, don't really know who works for them. And I mean, if you're the head of a 1,000-person company, I get it. But even with smaller companies, I mean, do you find, as a general rule, is leadership with the people you work with, is leadership lacking in that? Is it a laziness thing? Where does that kind of come down, in your opinion?
I don't think it's a laziness. I really don't. I think people have got great ability and great capacity to be great leaders. Most of us don't know how. That's the challenge. And I think there's 2 parts to this. One, is in the healthcare world, especially, Kevin, there is a whole lot of promotion of more responsibility that happens to healthcare professionals that aren't taught and trained and understand how to do it. And they're doing their very best to respond, but they are overwhelmed and firstly don't have the skills and have too big a workload to be able to have that interested type approach. Secondly, for better or worse, there's been too many role models of leaders that we've seen on TVs and movies and workplaces and all sorts of places that are entirely about themselves. They are all about being interesting and looking and sounding interesting and being important, as opposed to being interested and being interested in others. But it's very difficult to be interested in others if you're overwhelmed, you're overworked, you don't have the skills, you're not coping with the job that's involved. And so that's my assessment of why we see not so good leadership. It's not because it's not possible, but it's because it's not taught, it's not trained, it's not understood, it's not focused on as much as the technical part of many jobs. This is not just healthcare. This is I work with service-based businesses in many different industries. And it's a very common theme across many industries.
I can imagine. Another thing that happens in healthcare, especially since COVID, I feel like is the talent shortages. And how much of that problem do you think is structural? How much of it might be cultural?
Yeah, look, I don't have a best guess for you in terms of the ratio there, Kevin. But health is hard. There's no question that health is hard. COVID was an amazingly difficult time for all of us, and COVID was a great opportunity for us to serve, but an overwhelming opportunity to serve and not be able to cope with all the other demands in our lives at the same time. It was overwhelming. Side note, though, every industry thinks that it's hard. Health is hard, but everyone thinks that their industry is hard. But I think the bit missing, excuse me, I think that we need to understand that the best cultures, which are sustainable workplaces with strong characters, not only are based on a system by design, but they've got this inherent belief and inherent mindset that's a give and take environment. It's a give and take environment from the leaders who are going to give more to their team when necessary, and they're going to ask more from their team when necessary, and vice versa. Team members are going to give their all when they're asked, but if they've got something happening in their life, or they've got a challenge or something's happening that they need to ask for some help with, some time off or whatever it might be, some support, learning support, whatever, then they are willing to ask for that as well. And so this undercurrent of we're all in this together, we've got a culture system, we know where we're headed, we've got a communication rhythm in place, and we're all here to give and take. I think that's when we have the best result in healthcare, Kevin.
And you've openly shared struggles and mistakes in your own journey. What is one belief that you might have held at one time about leadership that you've had to completely unlearn?
Yeah, Kevin, probably the one of the biggest things that I had to learn, and this is still a challenge for me, but I'm a healthcare professional at heart. I'm an empathetic person, and I really didn't understand the opportunity or the need as a leader in many parts of my life to realize that I need to hold other people to account. And so I had this horrible belief. Horrible is the wrong word. I can say horrible now, perhaps, Kevin, but I used to believe that the word assertive communication actually meant aggressive communication. And I did not want to be aggressive, and so therefore I avoided assertive, and therefore I was only empathetic, and that did not work. I was forever forgiving. I was forever taking, the other way around. I was forever giving to my team, giving to others, and not asking in return. And I believe there's a continuum, Kevin, and that is complete empathy on one side of the continuum and complete accountability on the other. And we need to adjust our mindset and our model in between. If I'm having a conversation with you, you're having a tough time, then I need to be empathetic with what you're saying. I then now need to understand that, and then I need to make a decision. Where are we going now? Kevin does work here, and what's his job? I need to hold him to account on the job that needs to be done. And that's a big challenge that I've had, and that it's a challenge that I continue to work through to this day.
That is such a good point too, because there is that tendency. I've managed people too, and I often would find myself being, for lack of a better term, just way too nice, way too, yeah. I mean, empathetic, or just, I don't know. Trying. You also get to that point where you have to figure out, like, you don't, the cool boss versus the effective boss, or the nice guy, because I've had really crappy bosses, and I've had really mean bosses, and like, I never wanted to be that. But at the same time, you have to have that assertiveness, or things don't get done. And also, a lot of times you end up not being respected, in my experience.
Entirely. You said too nice there, Kevin. There is I have an executive coach who I used to work with, who taught me this how to use assertive communication. She also taught me that the concept of being too nice, she's got an acronym for that, and that is NICE, is nothing in me cares enough to tell you the truth. Nothing in me cares enough to tell you the truth. And so if I'm not being brave enough to provide feedback in a respectful way, because I think I'm too nice to provide feedback, or too nice to hold you to account, then I'm making that about me.
Right.
And if I want to make you better, then I need to get over myself and communicate in an assertive way, because this is what the team needs, is what you need, and that's how we're going to be better in the future. And that was a really hard lesson for me to learn.
That's a really good way to put it too. Yeah, it's about you make it about yourself, because you want. Why do you want to be the cool boss or the nice guy? Because that's how you want people to, how you want to make people feel, so that you feel a certain way back, so yeah, you're totally right. It's an interesting balance, and not an easy one. I mean, leadership is hard, but as we wrap up, I'm curious, just if every healthcare leader that's listening could do one thing to improve culture in the next 6 to 12 months, what would you tell them to do?
Kevin, I'd tell them to consider what is their personal culture. And it's not a topic we've discussed too much yet, but the character of an organization is what defines the culture of an organization. But the character of a person is what describes them, and their personal culture can also be explored. And in my experience, when people understand their own personal culture, they show up as a more confident, a more assertive, and a more culture-first leader. And so, in short, I ask leaders, if you want to be a better leader, start by leading yourself first. And that is, there's a few questions. Who are you? What's important to you as a leader? Where are you going in your career? And lastly, who is your network of support to help you on this career journey? And I really think that if leaders can firstly start with that, and then with a level of understanding of themselves, then dive into the culture system that is part of the Culture is Everything book, or whichever approach they take. But then we can start doing for the organization, core purpose, core values, vision. This is the building blocks of a strong culture system, but it starts with the culture of the individuals in the team.
So is it kind of like it starts at the top sort of thing? Like your company will go the way your leader leads, sort of a thing? Is that kind of what you're saying?
Look, it's definitely part of it. But I encourage every person at all levels of an organization to have a clear understanding of their own personal culture. But we cannot and will not get healthcare professionals at the coalface treating patients, understanding who they are, where they're going, and their network of support, if we don't have role models who are doing it for them. And so that's where I'm coming from on there, Kevin.
Yeah, I like that. All right. Well, Tristan White, really good having you here. He's the company is the Physio Co. And the book, Culture is Everything, a playbook for intentional leadership in people-centric industries. Is that the full title, or did I make that up?
You made that up, Kevin. But,
okay, that's what I thought. Yeah. I don't know why I capitalized that part.
I've got a copy. I'll hold it up for you, Kevin. There we go.
There it is. Culture is Everything is the book. If people want to get in touch with you, what's the best way?
Best way, tristanwhite.com.au is my website. Head over there, send me a message. I'd love to hear from you.
Awesome. Thanks so much, Tristan. Great chatting with you.
Thanks, Kevin. See ya.